Welcome to Kaleida Health Medically Speaking and our special series on the fight against the coronavirus. As you can see, we have modified our format to practice safe social distancing while providing timely and factual updates from the Kaleida Health team during this public health crisis. We as a healthcare organization believe it's important for the Western New York community to hear from our medical experts who are leading the charge in our facilities and with our workforce of over 10,000 strong. I'm Mike Hughes, and this is Medically Speaking. Welcome, Dr. Hughes. Thanks for joining us on Medically Speaking today.
Good morning, Michael.
So, first of all, can you give us a sense how things are going as Chief Medical Officer, how things are going in the response here?
Certainly. And as you can imagine, as a large healthcare system facing a potentially daunting surge of COVID-19 patients, we are all in a mode of trying to expand our clinical capacity across all aspects of the business. And when you really break that down, you're talking about physical capacity, you're talking about supply side capacity, you're talking about equipment capacity, and then personnel capacity. So as we look to potentially handle a large increase in volume of very sick patients, we have to approach it from all of those angles, trying to really get ourselves ready for what may or may not be a very large influx of very sick patients.
So we'll take two of those that you mentioned. First is the personnel. So it's not easy to surge up. I know the governor said we have to increase between 50 and 100% of our current capacity. So what does that require in terms of the clinical personnel and in particular physicians?
Sure. I'll tell you what it requires. It requires our physician partners, our advanced practice practitioners, and even all the way down to our students, our nursing students, our medical students, to really step up to the plate, recognize what could be coming at us as a community, and really step in and be willing to utilize their skills across a wide variety of areas. So in particular, what's been asked of our volunteer providers is that they think outside the box. They think about increasing their scope of practice from what they don't normally do day in and day out, and consider coming into the hospital, for instance, and managing inpatients or even ICU patients for that matter, and really thinking larger than their own private office or clinic space, thinking about how the system is really going to need their talent.
And so with that personnel, obviously you're going to need additional equipment or conversion of space. So if you can talk about the infrastructure, whether it's ventilators, beds, and the conversion of space that's inside the hospitals or even the ambulatory side.
Right. So we're, as most of you have seen last week, we canceled elective surgeries. We've started to really decant many of our hospitals and any elective admissions. That's all in an effort to really free up not only bed space, but then the equipment that comes along with managing patients in those spaces. So we're doing everything from utilizing OR space and their equipment to manage now sick patients, procedural areas, where can we put patients in those areas using the equipment that is already existing there, in addition to bringing in outside equipment such as ventilators and other equipment to manage really sick patients. And it's been an incredible exercise in how we as a healthcare system can really flex up in capacity, and in some cases increasing to 150, 200% of what our daily capacity really is.
So I know the public health officials and the elected officials are working on policies and procedures to help flatten the curve, meaning to help reduce the spread of the virus. But the goal that you guys have talked about really is protecting the workforce. So talk about what you're doing there, in particular, the new move to go to universal masking.
Yeah, very, very important from our perspective in protecting the healthcare workforce. And there's multiple fronts on that. First of all is how do we limit the spread of the disease, in particular amongst our workforce? And that comes down to social distancing, comes down to universal masking that we're implementing today. And you got to remember, when you do things like that, you've got to make sure that you've got a supply side that's able to support that personal protective equipment on a daily basis in very, very large volumes. In addition to that, you've already talked about screening at the front door from a temperature monitoring standpoint. Really, so that's one piece of it. The other piece of it then is ensuring that our healthcare workers have access to testing for the virus, should they have come into contact with people with COVID-19, and really prioritizing that testing to the healthcare workforce. Thereby really ensuring that the healthcare workforce is first in line for those things. Otherwise, what the recommendation is to the general public is that they self-quarantine for 14 days. And you can imagine the effect that that would have on the capacity of our workforce if people were quarantining for up to 2 weeks.
Well, Dr. Hughes, thank you for practicing safe social distancing today through this interview. Thank you for your service during this time of crisis. We appreciate your time.
Thank you. I appreciate the opportunity. And again, stay safe, stay distant, and good luck.